Continuing now with our focus on the tremendous pressures facing teens in our community, the district's Stephanie Bethel is here with a look at how the health district is focused on another very serious issue, teen suicide. Stephanie?
Thank you, Brian. Nevada consistently ranks among the top 10 states for teen suicides, an issue that's recently received more attention in the national media due to cyberbullying. Sadly, it's not a new phenomenon, and it's not limited to any certain sector of our younger population. Suicide is often depicted in simple terms like something caused by one event or one moment that caused a young person to end his life. But as Mike Bernstein of our Office of Chronic Disease Prevention and Health Promotion explains, there's usually much more to the story.
Suicide is not an impulsive act, and that is some of the newer research that's gone on over the last 10 or 15 years where they've actually looked at suicides, both adults and youth, and they're finding out it's not just a spur-of-the-moment thing. This is a progressive illness. Now, if there's some kind of a mental illness like bipolar or some kind of depression, that can exacerbate the situation, but over periods of time, people start to disconnect from their lives, their family, their friends, and it doesn't happen overnight. This is more, that's one of the signs that the isolation, more isolation, giving away, giving away their possessions, and this is just like a constant. We talk about bullying and being harassed, but this is constant over a period of time, which causes these changes in a person's ability to look at themselves and see themselves. They lose connection with society, and so the idea with prevention is to try to find people who are experiencing those kinds of things in their lives at an earlier place, somewhere along that continuum, and interrupt that continuum and actually get them counseling and help and work with them in whatever they need. You're going to be more successful that way. So oftentimes, when people get no help, and on the appearance on the outside, they just say, well, the person appeared fine to me, and then the next day they were gone. It's just like, it wasn't really like that for that person. It's just that everybody outside didn't notice, and that's another thing of, training people in the community, especially what we call gatekeepers, people who have contact with, youth, is like to learn the signs and symptoms.
A list of those signs and symptoms, as well as resources and gatekeepers, as Mike described, is available by contacting the Office of Suicide Prevention in Las Vegas at 486-8225. However, since teens are more prone to seek help online, there's a specific website just for them at reachout.com.
One of the things we did was we had developed some public service announcements years ago, and we used them, and they were very well received. We took those same public service announcements and re-tagged those. There's a new site that's been developed nationally for kids who have questions about mental health and all kinds of issues, bullying, suicide prevention, not just for themselves but to help friends, and that's called reachout.com. And so any kids who want some information and just want to check it out themselves can go to reachout.com, and there's a whole host of information on there, and it's a place I really like to refer young people to, because it's been looked at by the experts in the field, and everything on there is pretty good information.
In addition to having resources available for teens and young people who are seeking help, the Health District is also working proactively to identify at-risk teens before their problems reach a crisis level.
Well, part of that is trying to screen people. And that's one of the projects we're doing under this grant is trying to initiate screenings of kids in particularly whether it's primary care physicians or clinics or in schools. And again, there's a lot of obstacles in dealing with all these situations, but this is one of the programs we're doing.
The Health District would like to remind anyone who is in trouble that you are not alone and there are people who are available to help. Most importantly, there is no stigma in asking for help.
It's real simple. If your child breaks their arm, you go get medical help. Your child's sick, you go to the doctor, you get medical help. But if your child has a mental health problem, you're sometimes like, well, that they're just acting out. That's, again, if it happens over and over again, well, you need to get some help. But people, they worried that, they'll think that I'm a bad parent if there's something mentally wrong with my child. And you have to understand that health is not just physical health, it's mental health and emotional well-being.
That website again is reachout.com. The phone number for the Office of Suicide Prevention in Las Vegas is 486-8225, and the National Suicide Prevention Hotline is 800-273-TALK. Perhaps if we all take the time to learn the signs of a teen at risk for suicide, we can put an end to this needless waste of young lives. Brian?
You're right, Stephanie. We all need to become gatekeepers. After the break, we're going to tell you about a new program helping people in Clark County manage their diabetes. Stay with us.
You might notice a few strange things. Like the fact that even though the sun was shining and it was 90 degrees, she would be wearing a long-sleeved shirt. Or that she always folded her arms and never looked at you in the face.